You're watching Break the Pain on ABC 27. Brought to you by Penn State Milton S. Hershey Medical Center.
And welcome back. Dr. Edward Fox joins us in the studio. You know, Doctor, we were talking earlier about the show, before the show, about the fact that some of these terms are a little confusing. Osteoporosis, osteoarthritis. To a layperson, that sounds similar. What's the difference?
Well, osteoarthritis is really a disease of the joints. It's a wear and tear of the cartilage that leads to arthritis, whereas osteoporosis really is a bone disease of the skeleton that causes low bone density and causes those bones to actually be weaker and subject to fracture from a low energy injury.
Well, now, what kind of a test for osteoporosis? We hear about that a lot. What kind of test do you have for that?
Right. A DEXA scan is what you use to determine if you have osteoporosis. It's otherwise known as a bone density scan. And basically, you lay on a table, much like an x-ray, and subsequently, the scanner goes over the body, scans the hips, the spine, sometimes the wrist, and it allows us to calculate a bone density from that measurement. It's a pretty quick study. It only takes about 7 minutes to 15 minutes, depending on the scanner. And from that bone density, your doctor can tell you whether or not you have osteoporosis or osteopenia, kind of like a lesser form of osteoporosis.
Now, is this more common in seniors, and is it more men, more women?
Well, anybody at any age can have osteoporosis. Even children can have osteoporosis. And it depends whether or not they have certain disease states, like, for instance, kidney disease or liver disease can make you predisposed to osteoporosis even at a young age. Also, certain chemical drugs can also cause osteoporosis. Things like chemotherapy agents, things like corticosteroids or steroids that are used to treat rheumatoid conditions.
Well, once diagnosed, what kind of treatments does someone have for osteoporosis?
Well, there are a variety of drugs out there that are very effective in terms of treating osteoporosis. Some of them are hormonal, others are chemical that are used to prevent further bone loss over time. It's really up to your doctor to determine what type of drug is best for you.
Now, we talk about foods, you hear that in some TV ads and so on. What kind of food provide the most calcium and the most vitamin D? I mean, is it pills or is it just regular old food?
Well, dairy products, by far, by tradition, have been the highest in terms of calcium content. So having a healthy diet of dairy products from age 0 to 30 is really important. There are other types of foods that will provide you with adequate calcium. Broccoli can be high in calcium. Oily fishes, believe it or not, things like sardines and salmon have a high dose of vitamin D per serving.
That's good. If you like salmon cakes, you're in good shape there. Now, can someone prevent osteoporosis?
Somebody can prevent osteoporosis by, number one, making sure that they have adequate amounts of calcium and vitamin D in their diet from age 0 onward. They also should maintain a healthy lifestyle, active, not sedentary. And when you do get to that point, when you're, let's say, particularly a female who's postmenopausal, they should really start looking into the drug treatments that prevent further bone loss because calcium and vitamin D alone are not going to be able to prevent further bone loss after menopause has occurred.
Okay, Doctor, and right now let's go back to the ABC 27 call center for the last time tonight. And Deborah, you have some more questions to share.
Yeah, we have a couple, Chuck. Several years ago, I was diagnosed with shoulder impingement. I've gone through physical therapy and have had steroid injections. I still have trouble with both shoulders and cannot raise my arms above my head. Where should I go from here?
Well, Deborah, for those of you that don't know, impingement is when the rotator cuff and the bursa impinge upon the acromion, which is the bone at the top of your shoulder. Oftentimes this causes pain, but usually responds to physical therapy and injections. Over time, it can lead to a tear of the rotator cuff just through mechanical wear. You should probably see an orthopedic surgeon and consider an MRI.
Okay, and here is another question, our last question for the night. What causes calcification of the joints? Is this affected by your intake of calcium? Is there anything I can do to prevent this from happening?
We're not sure what the cause of calcium deposits in your joints are. As you know, it's common in the shoulder and can be a significant source of pain, particularly at night. There's no recommendations on limiting calcium intake. fortunately, it usually resolves on its own within a year or two.
Okay, great. Thanks so much, Dr. Gallo. Thank you for taking the time and answering the questions. And we want to thank all of the specialists here for answering the questions. You can see they're still very busy. You can keep calling in, and don't worry, someone from the Med Center will get back in touch with you. You can email us, continue to email us questions as well. And we'll send it back to you in the studio, Chuck.
Thank you, Deborah. Doctor, we were talking during the break there that is the public more aware of osteoporosis and these kind of bone deficiencies? Are they coming to you more informed? Do you see a difference in the patients because of TV commercials?
Usually it's not the public because it's a silent disease process. Osteoporosis doesn't cause pain. It's something where you lose bone. It doesn't cause a fracture until you fall. And then that makes the osteoporosis an issue where it becomes documented or detected by your doctor, and your doctor then starts to treat that osteoporosis. So really, more and more physicians are becoming aware of osteoporosis as a problem, more so than the public.
Always making progress.
Right.
Thank you, Doctor, for joining us tonight.